So welcome to everyone to our Tuesday mornings live seminars on the YouTube channel. We are entering the last two webinars of our series. It was series 1 was amazing. We had everyone from the Academy, everyone from the International Advanced Dentistry, and some guests. We did every Tuesday a lit review and treatment plan seminar. And of course, today we have the pleasure of having one of the best. Já estou a preparar o meu terreno para os próximos dias. We're going to have one of the best. She comes from Venezuela, Caracas, Venezuela. She has been living in Portugal for the last 14 years. She's almost Portuguese. She likes bacalhau. She's a big fan of bacalhau and steak, Portuguese with how do you say it? With horse egg, steak with ovo cavalo. She's a big fan, and she's gonna talk to us about this important topic that we've been neglecting, and now in a more serious tone, we've been neglecting for the last 20 years. That is. How or when do we should bring the kids to have our first appointment? It is very important.
And for the orthodontist?
No. Bring for everyone.
Okay.
And why is this important? I am Andre. I'm from the oral surgery department. And this is a very serious topic because in the last 20 years, the amount of pathology that we see from the ages of 1 year to 4 years is huge. And sometimes, we catch these kids in a status where, it's very serious, the pathology. Whether if we catch these kids in younger ages, we can still save some of them. So, in oral surgery is very important, but is also very important on the orthodontic level and on the pediatric level. Because some of the malocclusions, and in the Portuguese population, I would say almost all the kids have problems with occlusion, and that is due to relate of our skeletal system, the heritage that we've been given from our grandparents. So this topic is very important, and I hope you enjoy Dr. Elena Cerviño lecture today. And for us, it's a big pleasure that you are here with us, that you took your time from the clinic to stay here with us. So, Dr. Elena, the stage is all yours, and let's have a big round of applause.
Thank you. Thank you, thank you. Thank you. Thank you for your introduction of me. First, yes, I'm Venezuelan, and I'm not almost Portuguese. I am Portuguese. I have the passport. Okay? I am Portuguese. I don't like bacalhau.
No.
But okay, let's talk about in English, okay? Because today I wake up with the English language, okay? I don't have a pointer. Yes, I'm going to talk about a very important topic that it's getting more importance now, okay? Because I think that even dentists doesn't have idea the right answer, okay? And yesterday, I went to the American Association of Orthodontics, okay? And it's true that the Americans are very practiced. They have a guide, they have answers, okay? They are very prevention way. They treat very preventive way, okay? Now that we are in Europe, I think in Europe, we miss to explain the community and the health community, even the pediatricians, when it's the best time to bring the kids to the dentist. not the orthodontics, to the pediatrician for dentists, okay? And they have a guide, it's very interesting, okay? And they said that the later age that you should bring your kids to the orthodontic is with the age of 7, okay? That I'm not agree 100%. I'm going to explain you why, okay? And when you see, and the Portuguese Association, they don't have a site. They have a different site, the Association Portuguese of Orthodontists. This is a private, okay? It's not members, it's only the specialties, okay? And they said 6, okay? 6 is the latest age to bring your kids to the orthodontist, okay? But I prefer to explain you with the facts, okay? With the clinical facts, okay? This patient, it's with 4 years old, okay? And it presents a crossbite, an unilateral crossbite. You can see the picture is not the best because it's a little bit not focused, okay? That we have on the left side a crossbite on the old quadrant, okay? Since the lateral to the molar, okay? We don't have a mixed dentition. We have here a early dentition, only it's baby tooth that we have here, okay? We have the midline, it's off, okay? To the lower is to the left. Of course, that we need to check, this is a functional crossbite. Why? Because we have a constricted maxilla, okay? That now we can see that we are seeing this more frequently in our clinics, okay? And not the orthodontics, okay? It's the pediatrician that looks that. After 6 months, our result was this. We already have the correction of the crossbite, the midline is on, we didn't put any appliance, okay? It was only a very simple treatment, okay? Look at this girl, look at the smile is on, the midline is on, and the crossbite was corrected, okay? You can see before and after, okay? How we correct this? We just put a, I don't know how to say in English, una pista directa, direct,
Slope?
Slope? No, it's I have to, can you Google it, please? It's
How do you say in Spanish?
Pistas directas.
Pista directa.
Okay?
Pista directa.
It's a simple composite, okay, that we do on the clinic, okay, on the chair, okay. Of course, that you do it, that you have to manage the midline when the patient close, okay. Try to put the midline on and the mandible on more than the teeth, okay. And of course, it's going to finish with the open posterior bite. But it's the philosophy of Pedro Planas, that he was Spanish, okay? And this is not new. This has a lot of years that we have this, this way to treat the kids. It's very simple, okay? And I love to treat these kids because the parents, her mom, used aligners. Her sister, no, her boyfriend, no.
Brother.
Her brother, sorry. Her brother has aligners too. And when you suggest this to the parents, okay, first impression was they think that I was kidding with them, Like, no, it's very simple. I don't need to put an appliance. It's not braces, not aligners. It's a simple composite, okay? And they didn't believe on me. But then I told him, don't worry, okay? Believe on me. I will demonstrate that it's going to correct, okay? And they were very happy because with not too much money, with not too much time, with not pain, we correct a girl that could be with asymmetric mandible, with the big problems on the condyles, and with she's going to grow up asymmetrically, okay? And we just correct a simple problem with the composite. Then I have another girl with the same age, 4 years old. No, she was 5, but everything was a baby tooth. Don't mix dentition, okay? It's a primary dentition, okay? She has the same, a crossbite, very big crossbite, okay? On this picture, you can see how she switched the mandible. She can't close with the mandible on the center of her face, okay? She is the third girl, the third daughter of 3 girls, and the 2 older girls, sisters, are my patients, okay? That's why it's very simple to explain to the parents that we want to avoid a treatment, okay? A future treatment. And of course, they agree with me. We put our pista directa, directed lane. It's a composite, okay? It's a composite. We have to design. Then with bird, we try to model and don't leave the patient with a very big open posterior open bite, okay? But they don't have pain. They don't have problem with eating. The own forces of the occlusions, okay, correct the teeth. Okay. And that's why it's very simple, okay? Look at the evolution is just 4 weeks, okay? Let's see, before 4 weeks, okay? We correct, we try to do a little bit with the bird on the lower canine, okay? We wear a little bit to relieve any premature contact on the crossbite side, okay? But you can see the evolution, okay? Not open bite, not crossbite on the posterior, and we correct the problem. Now, look at the midline. Now she starts to be a mixed dentition, okay? But we start with the first dentition. Look at the face. Now you can see the Margarita doesn't need a future treatment, okay? We avoid to spend more money, to spend more time, to grow up, okay, with symmetric face, okay? That's why it's very important, okay, that all the specialties needs to know that the kids, you need to treat the problem when they are on this age, because you are going to avoid so many problems on the future, okay? Look, any appliance, just the pistas planas. Okay, look at the maxilla, okay? I didn't treat her, but look how it's wider. I didn't close the space, the space opened because of her occlusion, okay? It's the forces of the occlusion that correct. What we want to avoid in adult to present to my appointment, okay, with ATM problems, with asymmetric face, the mandible is to the right, okay? Look at her, she is all asymmetric, okay? Look at the dentition is a constricted maxilla, the negative torque of the posterior occlusion, okay? Look at the x-ray, we have a different, okay, different size of the rim. What? Now, if she would be a symmetric person, she needs a surgery. And the cost of the surgery on the private, it's very expensive, and it's not easy to recover for a surgery, okay? That's why we need to avoid. And if you ask me now, when is when they have teeth, okay? When they have all the baby teeth, they should go to the dentist, and the dentist needs to know it has a crossbite, it has a constricted maxilla. It's very important. All of us needs to know all the problems that we can avoid, okay? We call orthodontic, in English, I have in Spanish. Interceptive orthodontics. That means that we are going to do a little things, okay? We are not going to correct the whole malocclusion. We are going to do an interceptive orthodontics, just to correct we need to go, okay, and to try to deviate the growing of the direction of the growing of that skeletal, okay, problem, okay? We can resolve a problem with the space. We can resolve open bite. We can resolve anterior cross bite, anterior posterior bite. Okay, of course it's little problems that we can correct in this mixed dentition. Like this, if we see a patient with anterior cross bite, we have a mixed dentition. We have to correct this now. If we don't have the space for the lateral incisors, we need to correct this right now. We have an anterior crossbite. We miss the space for the canines. Anterior crossbite, very severe crowding. We have to correct the very severe crowding when they are on mixed dentition. It's going to be easier, faster, and cheaper. Okay.
So when you talk about mixed dentition, what is the age of these kids? Okay,
it's depends. We have since 7 years old. 7 years old. This was 8, but it's around 6 and 8 years old. They start to be a mixed dentition. Okay, because if you don't correct this problem, this patient is going to lose the lower incisor with the occlusion, because with the anterior case, we saw the power of the occlusion that can correct something or destroy something, okay? That's why it's very important to see this. This is some of the appliances that on the intercepted orthodontics, we have a lot of them since the 20, 30 years, okay? We have a lot of the market. We have the braces that we did a long time ago, but it's not the same to show the patient and the parents to do this. I remember this girl, okay? It was very hard to put the bands on the molars, okay? The molars on this age is not completely erupted. It's very hard to put. This girl was crying, but on that moment, it was my only solution that I knew on that moment, okay? But now we have these kids, okay, that they don't want these treatments. Now they go to TikTok, they go to YouTube, they know a lot, okay? And this generation born like this, with the cell phone on the hands, okay? And why we are not going to upgrade, okay, our kinds of appliance to treat these kids, okay? Because we have now the alpha generation that they are 100% technological, digital, okay? And why we are not going to upgrade to treat the patient with a composite, with aligners. It's very simple, it's very easy for them. They keep the oral hygiene, and I think we have to upgrade. We have this kind of patient that is Z generation, okay, that they are not 100%, but they want to appear on the TikTok, and we have to treat them earlier. We have to do earlier treatment. We have this patient, all of them are my patients, and they are very good patients with aligners, with elastics, okay? They are better than adults. And it's like we have all of us smartphones. Why we are going to give you our patients that appliance since 40 years ago, and we are not giving to them the best technology that we have in orthodontics, in dentistry, okay, to give it to them. And that's why I bring this. I don't say that this work. I'm not telling you that it's not work. That appliance work too. But it's going to make the call. But it's not going to be the same, okay? We have application on the phone. Here we don't have application, okay? And that's why I bring this comparison, okay? And we have all of these kids that we can treat them in a very simple way, in a very sympathetic way. When they are going to be adults, they are not going to remember, do you remember when I did that treatment? No, for them was very simple, and they remember with happiest. I don't know how to say, but this patient, I just treat him 6 months in between of 3 years. Her mom is pediatrician, and she was very happy because we changed his profile, okay, just with moving teeth and the early treatment and mixed dentition, okay? And that's why we are very, it's in our hands, okay, to change the face of these kids, okay? It's on the orthodontics, on the surgeon, on the general dentist, on the oral hygiene. It's very good that if the patients go to Pedro and has something, Pedro knows that, no, I need to call the orthodontic department to see what can we do for you, even if you have a kids, okay? Because we change profiles, okay? And we have a very happy patients, okay? We have a motivation patients, and sometimes with a very simple button and elastic, we can correct a crossbite. He didn't have a crossbite, anterior crossbite, but he has a posterior crossbite, and I asked the mom to put the kids the elastics, okay, when he was sleeping, and try to put until the morning in the school. And they did for 5 months, okay, and now we correct the crossbite. It was very simple, very cheap, not painful, and that's why we have to manage these kids on mixed dentition. It's like the anterior crossbite, okay? We only treat the anterior crossbite. We didn't treat him the lower teeth, and look at after we finish the treatment. With any treatment on the lower, it's correct band itself because of what? Of the force of our own occlusions, okay? And now, this patient, okay, he came to see if we can do something, but look, everything is correct, okay? We are waiting for eruption of the canines. I don't have nothing to do with him because we correct the anterior crossbite at the perfect moment, okay? And he was 7, okay? It's like Francisco, it's the same. I treat the anterior crossbite and the lower teeth correct by themselves, and I didn't treat him. Like Gustavo, it's the same, okay? We have a lot. But this doctor from Barcelona, he did a beautiful work talking about he has a Rehabilitación Neuroclusal. He has a book, and I recommend to read his book to everybody because it's amazing, the work. And after the Spanish Civil War, he lived here in Portugal, in Porto, and with the Dr. Professor Magalhães. They did a beautiful work, and nowadays we have that knowledge, and that you have to be very creative to do the pistas planas from him, because I love his work, okay? And I came late today because I was trying to find a presentation that I did 7 years ago with a pediatrician and orthodontics and other pedopediatricians. We did all together, and I speak about the importance of the pediatrician when they go to their appointments, because they used to say, open the mouth. And I save a video with Dr. Nuno. This is the pediatrician of my kids, because like I have 3 kids, I used to go a lot to his appointment, and he used to say, open the mouth. But they never ask the patient, close your mouth. And if the patient don't close the mouth, the doctor can't see if they have anterior crossbite, posterior crossbite, constricted maxilla. And that day, at least, we had like 15 pediatricians that I asked them, please, ask to the patient with that little things, spatula, that they saw the straw, they saw everything, please ask the patient, close your mouth, okay? And it will help our society to learn and to know more about these problems of the kids, okay? And of course, if you work with the pediatrician teams, that they always ask me to go to the appointments, always. And I always go and see, yes, we work like a team. And that's why we are to avoiding future problems for our patient. And I think we have a very important tool in our mouth to see these kids in our clinics, okay? And this is my message for all of us, all the specialties. Try to know and or take a picture for the orthodontics to try to avoid these problems, okay? And of course, my team, I always thank my team to be here, and thank you. Sorry about my English, but I'm going to practice again with the Portuguese and with the Spanish. And have a good day. Bye-bye.